Welcome to the podcast. My guest today is Josh Rich. He is with CenterWell Home Health. And welcome back.
Thank you, Dave. It's a pleasure again to be here.
Well, we really enjoy having you on because I'll tell you what, home health is really a big issue. There's a lot of people that need health services in their homes. And I thought maybe today we would start out with something a little bit different than we have in the past.
Okay.
Now, I guess for most people when they get older, as I've told you before, I'm getting to the age where these services may be coming my direction because we just never know.
Right, exactly.
Well, there's no guarantees to this life. But as I think about these things, I'd say most people out here, they like to think, well, boy, I would really like to stay in my own home. That's always the first priority, to stay in your home. Some folks think they're never going to leave out of their home, which quite frankly is for most people is unrealistic.
Right.
So sometimes we're trying to move people to think and be, as I've said in another podcast with someone else today, was we have to be proactive.
For sure.
We need to think about where things are going.
Exactly.
If you're a caregiver out there and you have a parent, a loved one there, you need to be thinking ahead, not waiting to the last minute about it. You need to look at some of this stuff now.
Yes, sir.
So when it happens, it's not going to be a shock, or you're not under that pressure.
Correct.
But sometimes when you're under that pressure, you don't make the best of decisions.
That's absolutely correct.
Well, the point I guess I'm getting at is probably the greatest fear of a lot of people is, how am I going to pay for this?
You're right. Everybody has tight budgets. But something, this is the third time I've been on air with you. I don't think that I shared with the audience that our services are typically covered 100% by Medicare or a Medicare Advantage plan. So it is truly, big picture, is an underutilized service that so many people qualify for, but they either don't know that it's an option for them. And it's just a shame because, like you mentioned, everybody's dream is to stay at home for as long as they can. And why not take advantage of services that are provided through their insurance and to help make that happen. Stay at home as long as possible.
Now, I want to give you a little caveat on what you mentioned, if you're eligible.
Correct.
That is the correct words I want to say because, yes, I understand that, but there's always that one in so many that might not be.
Right.
So I'm just to make sure that for the most part, it's probably going to be covered.
Right.
But you don't know if you don't find out.
Exactly. But I would be surprised that this, and let me clarify, we provide the skilled services, which is, skilled nursing, physical therapy, occupational therapy, speech therapy. We do have home health aides, but there's a huge need for services like dressing and bathing and running errands. Unfortunately, that's not the service that we provide. But if there's a medical condition that justifies our services, maybe it just be something where the patient is having trouble managing their medications. They go to the hospital because they have confusions on if they're even taking their medications correctly. Or, maybe there is a major surgery involved. Maybe someone is frequently falling and we can send therapy services to help address that.
And falling is one of the greatest threats to our senior population, correct?
For sure. You never know what that's going to lead to or what caused the fall. A lot of us think simply that, hey, we slipped on ice, or, the colder months are approaching. But, maybe the blood pressure dropped and that caused the fall. So, when you get services set up, we can dig deep to figure out what's going on and what's causing whatever issue it might be. Maybe it's a medical condition where skilled nursing is more appropriate, or maybe it's just generalized weakness that we can address through physical therapy and occupational therapy.
Now, some of the services that CenterWell Home Health provide are obviously skilled nursing. I'm going to read these off because I think it's just as easy to read them. Home health aid services, physical therapy, occupational therapy, speech therapy, and medical social work. These are the types of things that we're talking about. So
correct.
The public that's listening to us understands what we are talking about.
Exactly. You go through all those services that we provide, and it just a light bulb went off in my head right now that every single one of our clinicians, they are CenterWell employees. We don't have to contract out any of our services other than, I'm kind of contradicting myself, other than speech therapy. We addressed that one other time. But, I take pride in that because, every morning we meet as a team by phone, and every Thursday morning we meet in person. So I think that's huge that all of our staff are our staff members because, we want what's best for the patient. I truly feel that that is best.
I got to thinking of a word, just one word there, consistency.
Yes, sir.
And that means a lot.
Right.
Especially when you're older, you like to see the same person who I'm dealing with.
Correct.
I'm the same way myself.
Right.
That, you like to know, well, yeah, I know this person, so I can count on them.
Right.
And I think you make a very, very good point, Josh, with all this. Anything that you think else that kind of stands out specifically about CenterWell Home Health? Now, you guys are pretty highly rated when you start looking out there, checking these things out, correct?
We are. If you got the time, and I really recommend it. We're dealing with our loved ones here who we want the very best for. And I would encourage anyone to go on Medicare.gov and do a home health compare. You can just do a search like that, Medicare.gov, home health compare. You can put your zip code in, whether it be, here in Bucyrus, up and over to Gallion, or down in Marion, wherever you might be, and put the zip code in, and all the home health agencies who provide services for that area will pop up, and it will provide a star rating. And again, I'm a physical therapist assistant by heart. I couldn't do this job if I wasn't representing a great team. And if you do that search, you'll see that CenterWell Home Health is highly rated.
Well, and that's a good thing to know. And speaking about good things to know, now you cover, I'm speaking Josh here,
Correct.
You cover Marion County, right?
Yes, sir.
All right, all of Marion County.
All of Marion County.
Now, in Crawford County, it's a little bit different. Am I correct?
It is.
All right, kind of maybe mention that to the listeners of the podcast.
I can assist really with any referral.
Okay, on the referral process, you can help them.
Correct. But as far as, our clinicians in the area that we cover, Bucyrus is covered out of our Marion office.
Okay.
And then if you go east over to, say, Upper Sandusky and Wyandotte County, we cover that out of Marion. But then when you go west,
Yes.
get my directions correct here.
Well, that's all
west, But if you truly do go east over to Gallion, then that falls into the Ontario office.
Okay, the same would be for Crestline?
Correct.
Okay, Gallion, Crestline area, they would go into the Ontario.
Yes, sir.
But you can get them placed.
If you happen to be at, say, Alder Care or over at Legacy or at the hospital here in Bucyrus, or if your primary care physician is located here in Bucyrus, I can help coordinate the referral even if you live over toward Crestline and Gallion, and that's that.
Okay, I just wanted to make that clear because I know Crawford County is a little different than Marion.
Correct.
And like I say, our podcasts go out all over the place.
Yes.
But especially here in Marion County, you got that covered.
Yes, sir.
But in Crawford, it's just a little anomaly, but
Right.
not a whole lot here.
Oh,
You can get the help.
Right. I have a great working relationship with our office in Ontario, and Kelly Schaefer is in my position out of that office in the Gallion area, so I could just give her a quick call or the office and coordinate anything you need.
Anything else you want to share with us today, Josh, regarding CenterWell?
I just can't express enough how I appreciate this opportunity, and I think this goes for everyone that you interview, that it's great to get the good word out to the residents in our communities, and I particularly love the senior population, and it's important to get the word out of all the services that are out there.
Well, again, I want to thank Josh Rich from CenterWell Home Health. I did get it right, CenterWell Home Health. Josh Rich, for being here today to be a part of the podcast again.
Thank you, Dave.
Thank you. And again, like I say, I know you, by the way, I should add this to the end of this podcast as well. Josh and them, they're really involved in the community. I know they do a lot of good things. We didn't get into that a lot today, but I know that they have a real heart for seniors.
Correct.
So I do thank you for that as well.
Thank you for mentioning that.
All right. Thank you, and we'll see you again on another podcast.
Great. Thanks again.